What is the placebo effect? Here's a hint. It's not how we typically discuss it. When we talk about the placebo effect, there's a whole bunch of different ideas that get offered. One of the offers that usually comes up when we talk about placebo effect is the fact that it has to deal with someone having a response that would be the drug, but where we give them some sort of sugar tablet, some sort of inoperable or unoperable or inert medical treatment. The idea of placebo is a very old idea within medical treatment. The first noted indication for use of placebo is in the late 18th century, 1772 to be specific, with the indication of a placebo effect occurring with a reference from 1775. These older references give rise to the more modern references that we think about when we think about placebo effect. But what really is the placebo effect? The placebo effect really is a statistical phenomenon. It's not really a physiological issue, even though we think about it as a physiological issue. It's the indication that my control shows no difference from my treatment. The inert substance is going to provide the same or a better response than the active ingredient that we see within a treatment. But what is it really? And what we tend to think about as the placebo effect is really a Hawthorne effect or an effect of expectation. The effect of expectation tends to be a logical fallacy, whereas the Hawthorne effect, while sometimes referenced as a logical fallacy, is not a logical fallacy. While the placebo effect is an effect of statistical analysis based off of differences that we see between my treatment group and my control group, the Hawthorne effect is a psychological effect. It's a psychological effect that's going to change my behavior. And by changing my behavior, I can change the outcome or the physiological responses that I might see from an active treatment. The Hawthorne effect comes about due to the psychological effect that we have based off of a sense of being observed from afar. Sometimes this gets lumped into an observational bias, but it's different than the observational bias. Within the Hawthorne effect, what ends up happening is that we end up having a change in our responsiveness based off of the implicit idea that what is being given to me is going to have an effect on me. And what that does is that will change various aspects of my physiology, various aspects of my psychology. And by changing those two aspects, we can have a treatment effect independent of true active ingredients within the treatment. We see this a lot of times with lifestyle interventions that correspond with or are used in conjunction with active pharmacological agents, active drug treatments, which is one of the reasons why when we look at a lot of the studies pertaining to mental illness issues, depression, anxiety, there's a lot of times where they indicate that the placebo effect is as strong as the effect of treatment. And the reason for this is because the drugs are not used independent of other treatments. And when I start seeing that, or when I start thinking that the drug that I'm being given, even happens to be an inert drug, is going to have an impact, I'm going to start changing the way in which I behave. And by changing the way in which I behave, it can lead to a reduction in the depression, the anxiety, the other aspects of my physiology that can exacerbate issues pertaining to things like depression or anxiety. We see the same thing with pain medication based off of the Hawthorne effect and the impact that timing has within the natural course of events within the natural pain cycle, which is going to wax and wane. It's going to increase and decrease over days, weeks, months, and even within days based off of minutes and hours of the day. That Hawthorne effect is a psychological phenomenon. It's a phenomenon that we can think about in terms of like the mind body interactions. The expectation effect is a logical fallacy. The logical fallacy with the expectation effect is where I'm looking for responses and I'm willing to give causal effect to the treatment based off of the responses that I see. This is my observational bias. So the expectation effect is a bias effect that can influence the way in which I interpret the findings of any type of experiment. Whereas the Hawthorne effect is giving me the psychobiological responsing that might explain why treatments occur if I have any type of neuroendocrine regulation within the treatment, because I know that changes in my cognitive approach can change my neuroendocrine responses by changing my overall stress levels. Those two can impact the way in which I see or interpret data, which leads to what some people refer to as the placebo effect. And so when we start looking at all this and trying to explain it to our students, to our patients, to our clients, or to ourselves, what we have to remember is that when we're starting to look at what the placebo effect is and what the placebo effect isn't, what we're really looking at is we're looking at how well do treatments actually work independent of all other treatment options available.